Namaste. Good morning to all the panelists who have joined from around the world and the delegates also who have joined. So welcome all to the Day 2 Vision on Holistic Health. Now, let me welcome Dr. Sharmila Asthana for the moderation part. Namaste, Dr. Sharmila Asthana.
Namaste. So, welcome back, everybody, to day 2 of this panel discussion on holistic human health. So, welcome to all the delegates, and I would say welcome to Dr. Rajalakshmi Iyer, Dr. Tanini. Very quickly, for those who were not there yesterday, Dr. Rajalakshmi Iyer is from Mumbai, India, from Grant Medical College, Bombay. She specialized in rehab medicine from Madras Medical College, Chennai. She worked at Christian Medical College, Vellore, and then St. John's Medical College Hospital, Bangalore, for about 17 years. And then she moved to AIIMS, Rishikesh, where she was the one to set up the MD program there. At AIIMS Rishikesh, she started and headed the Department of Medical Humanities. And she dreams of the day that there will be fellowship programs in medical humanities in premier medical institutions in India. Currently, she's on a sabbatical from work to care for her parents. Welcome, Dr. Rajalakshmi. Dr. Tanini from Bangkok, Thailand. She's a professor of pediatrics at Chulalongkorn University, Bangkok, Thailand, where she trained in pediatrics and pediatric endocrinology, after which she went for a 2-year fellowship at the University of California, San Francisco. Currently, she is Assistant Dean for Graduate Affairs and a member of the steering committee for the School of Global Health at Chulalongkorn University, where she is responsible for the Clinical Sciences program and developing the global health curriculum. She is also on the advisory group of the Association of Pacific Rim Universities, where she collaborates on education and solutions for global health challenges and equity gap. She has an active role in the development and implementation of humanistic medicine and education in Thailand. So welcome back, Dr. Tanini. We also have Dr. Swapan with us. Dr. Swapan is from Ludhiana, Punjab, and he has spent about 25 years with students. He has been teaching in MBA, in the MBA college, and he has also experimented quite a bit with the universal human values, and I'm sure he will have lots to share on the impact of that later today. Welcome.
Thank you.
Swapan.
Thank you.
Thank you.
Thank you.
If I may begin, I think for those of us who have joined new, there is Ms. Rita Seth and Ms. Vicky Rai. Together they form a team. They have been working with mental health in the area of mental health since a long time. Ms. Rita Seth is the co-founder of an organization called Sambandh, which has been working in mental health since 2011. Ms. Vicky Rai is also associated closely with this organization and with Ms. Rita Seth, and has been working in the field of counseling for mental health. So welcome to both of you. And now, if I may just briefly recap how we are going to run this session, then go on to the vision for holistic human health. So in this panel health discussion, I will be putting forward a little bit of recap from the keynote session that you heard this morning. But for those of us who may not have been able to attend it, not to worry. A small amount will be a recap from there, plus there will be more details on the vision for holistic health. Once I do that, then we will be putting forward some questions to the panel, to all the different panelists. When we put a question forward, the panelist will have approximately 3 minutes, a maximum of 3 minutes to answer, after which we will go on to the next panelist and so on. Ms. Rita Seth and Vicky Rai together will form one panelist. So one of them will choose to answer the questions. Since they have been working together as a team, we'll have them here also as a team. After we do 2 to 3 rounds of these panel discussion questions, then we will open the floor to the delegates to take their questions for another perhaps 10 minutes. And then we will conclude the session, put forward the conclusions of the panel discussion, and close with the invitation of coming back to the next session on implementation. So this being the case, let me share my screen and come to the vision for holistic human health. So if we look at what we discussed yesterday regarding the health, the condition of health today, and why there is a need for a holistic perspective. We talked of the many achievements that have been possible thanks to modern medicine and health today, like antibiotics, trauma care, vaccinations, and what have you. However, with that, there was also a series of concerns regarding the inadequate addressing of stress and mental health, a focus more on disease and its management rather than health, clarity of values in health professions with the feeling for patients lacking, perspective of the human being, seeing the human being in isolation from the whole, and the fact that healthcare is becoming increasingly inaccessible for the common man, a very high financial burden, and something that is not going to be able to sustain. So all these were some of the concerns which led us to feel that there is a need for a holistic perspective on health. So what would be that holistic perspective on health? Let us take a look at that. So one of the things that we spoke of was moving or shifting from a disease-centric approach, where we are talking of getting rid of disease, to one which is a health-centric approach. So if you look at some of the issues that were raised yesterday, we may be trying to solve problems. And in fact, if you look at it, whether we are really solving problems or we are providing symptom relief is another question. Suppressing the symptoms, but not really solving the problem. So one shift in paradigm would be to move from this symptom suppression to treating the root cause. Another paradigm shift would mean moving from disease itself to health. So in the health-centric approach, the proposal is, when we look at physical health, which is what we were talking about on this slide. So the proposal for a program for physical health could mean something like what is in front of your screen. A program for staying healthy rather than to get rid of disease, which would involve our intake, our lifestyle, labor and exercise, postures, regulated breathing, and all of this in addition to medicine and treatment. Now, I would ask you, should health education and healthcare be focusing on all these aspects, 1, 2, 3, and 4, or largely on 4? So we can reflect on this. Further, if we look at the approach that may be there, is about the human being a body. So even when we talk of mental health, we talk of brain, the brain being in charge of the body and being responsible for all the parts of the body and their functioning. Now, the problem with this approach is that it leaves several questions unanswered. For example, psychosomatic diseases. When we talk of brain being in charge, and yet we say we need to do such and such, who is that we? Do we have clarity about that? So the fundamental causes of psychosomatic diseases like essential hypertension, diabetes, arthritis, cancers, and so many other autoimmune disorders. Do we really understand the fundamental cause? And of course, if we don't understand the cause, how are we going to treat it? Similarly, phantom limb and so many other similar medical mysteries, near-death experiences, and so on. So we need to shift from having a body-centric approach to a self or consciousness or a mind, if you say, plus body approach. So in the mind-body approach, or the self or the consciousness and body approach, self is central. This is the proposal. And it instructs the body through the brain, which is a part of the body. Now, with this proposal, if we look at things, the root cause may be understood more easily. This proposal can address many currently unanswered questions regarding psychosomatic diseases. Because when we understand the self, we can address the problem at the root, which is in the self, and tackle these psychosomatic diseases far more efficiently. So we need to have more research in the area of consciousness, and this may help us deal more efficiently and adequately with mental disorders also. For example, if we look at our perspective about stress. So a lay perspective about stress might be that stress is outside, that situations stress us out, activities stress us out, people stress us out. And so stress management in such cases may involve avoiding such situations or activities or people, or engaging in other activities to take it kind of a diversion from these activities. But what is the reality about stress? Is stress out there or is it within? So when a person is in harmony, when he or she is calm, comfortable within, then it leads to harmony or health in the body. But when a person is in disharmony within, uncomfortable, unhappy, stressed, it leads to disharmony or ill health in the body. This is the proposal. Similarly, when we are in harmony, comfortable within, we respond to persons and activities, people outside. And along the same lines, when we are in disharmony, unhappy, or stressed within, we tend to react to the same person's situations and activities outside. For example, I will ask you, when does a mother beat her child? When she is comfortable within or uncomfortable within? Further, if we look at this approach that the human being is body, with that approach, people are unable to understand themselves. They are not able to understand the cause of many of the diseases. When the cause is not understood, the responsibility for the health of their body is outsourced to medical care. There is a fear among people that something untoward may happen to the body at any time. A feeling of helplessness that we cannot do anything. So a total dependency on doctors and hospitals, pharmaceuticals, and so forth. And with the lack of this understanding, people may or may not rightly utilize their body also. But if we have this approach where the human being is self and body, where self is the one that is central to our existence as a human being, and body is a tool. Now, with this proposal, there is a possibility where a healthy self, that is one with the right understanding and right feeling, could take charge, take responsibility for the health of their body so that it leads to good health, and rightly utilize the body. Looking at this diagram in a little more detail. So there is a shift required to focusing on the consciousness for keeping the body healthy rather than to manage disease. Once the self has the feeling of responsibility, it will be responsible towards nurturing the body, protecting the body, and rightly utilizing the body. In fact, if we look at consciousness, now, if we look at some of the people who have done some research in this field, one of them is Dr. Van Pimmel from the Netherlands, who has spent almost a lifetime working with near-death experiences. A cardiologist by profession, he was intrigued by cardiac arrests and brain death. And he has a series of examples of near-death experiences where brain death was declared, and yet people were able to, when they came back after a near-death experience, they were able to recall very vividly all the events that took place despite declaration of brain death. So much of his research is there in view of this idea that there is consciousness beyond death. So we can also have more research in this field so that we include this as a proposal, at least in our educational system. Further, is the human being an isolated entity or a part of a larger whole? So if we look at this approach that the human being is in isolation, then there is lack of clarity about the environment in which we live. If we look at broken homes today, broken families, there is a lack of a sense of relationship even with other human beings within the family. what to say of society. So ultimately, it leads to fear in the society. Even with nature, there is a lack of concern regarding nature, leading to attempts at dominating over nature. And all of this is further adding to the disease burden, ill health, mental and physical. So we need this fourth shift in paradigm also, moving from seeing ourselves in isolation to understanding that we are a part of a larger whole. So if you look on the right side of the screen, if our approach is that the human being is a part of a larger whole, a part of a family, a member of the society, a unit embedded in nature, then understanding the human being as self and body, understanding relationships with other human beings and with nature, people can have the feeling of relationship with other human beings and the rest of nature. So a very natural outcome of this would be a healthy self, a self in harmony, a happy self, harmony of the self with the body, and harmony of the self in this environment, leading to a healthy environment. So this can be movement from the current, perhaps body-centric, isolated approach to a proposed holistic approach where a human being is considered a coexistence of self and body, where health of the self is the number one priority, which can then add to or lead to the health of the body with the program of health and the health of the environment. So this is what I had to share. I think if I may, I will now stop the sharing from here and welcome you back to the question answer session of the panel discussion. If we look at some of the things that were discussed, several interesting questions were raised, I think, which we can now discuss and put our thoughts together regarding these. If we look at this, is it time, do you think, to address the role of the self or consciousness in the health and ill health of human beings on a priority basis? Dr. Swapan, could I have your thoughts on this, please?
Greetings to all, and very nice presentation, Dr. Sharmila. Very nice vision put up by you. Yes, I can tell with the confidence as you even while introducing me, you told that I'm doing this self-exploration. From that confidence, I can tell that before this self-exploration about who am I, so there was no vision about even the human being in totality to me. So I was just considering myself body, and then body was the source of my only happiness. So when I was not aware of the self, that there is a coexistence of self and body, as you told in your presentation, I was not able to see the relationship, even with my family close members sometimes. And it was bringing a lot of, then you talked about stress from outside. So when I'm considering others as responsible for my stress, and it's coming from outside, and I'm not taking any responsibility, so not even of the body, means then it brings issues in my relationships. Stress is increased, my complaints were increasing day by day. But now when we started doing with this UHV, started exploring, then I found that okay, I'm more than body. Who am I? Then started self exploration. Then I found that there is something more in me who is responsible. And then when I started working on that, I took the responsibility of the body also, because this is the health part. So I will tell you my experience that before this UHV, means a lot of stresses were there, contradictions, conflicts, and it was coming on the body also. And there was a constant headache, which I remember. And I thought that's a part. The life is struggle, I have to go on. But then those frustrations were coming outside also. And they were growing means time by time. And then I was not finding any solution. But then on self-exploration, I found that coexistence of self and body. And then I started realizing that I am responsible for my body. And then the headache, when it vanished, even I didn't come to know. It's a process. Like you have to understand that other person and even the nature, as you told, that we are coexisting with the nature. Now you see today, there are huge issues in the nature, the pollution and all that. Who is responsible? The persons with the wrong understanding. So understanding, who will understand? All these questions means it's all up to have to think now. Means lot of like yesterday we discussed in the need. Yes, lot has been done by considering body, but then it is not giving the solutions. If it would have given the solution, then why are we discussing today? So it is giving solutions, but then we have to look beyond now. And then in your presentation, we have to go solution centric. So my point is, we have discussed a lot about the body, but then I think this aspect of self has to be explored, and somebody has to take the responsibility of my body, my relations, my nature, and then I will come to the others. So it's my responsibility to take care of this, and then I think a lot of body issues will be resolved. That as I have told you my example. So I'm looking forward to that. This is what the vision is. I think we have to work on ourselves and try to find out that am I only the body or I'm more than that. Thank you. Thank you, Dr. Sharmi.
Very nice, Dr. Swapan. And I can see that you talk from experience when you say that some issues were taken care of when you were experimenting with these proposals. And I believe you lost a lot of weight also, which
Yes.
yes, and you
Yes.
became more alert.
And I tell you, Dr. Sharmila, that you told intake, and I've lost my weight only by these three first. Intake, I worked on my intake, daily routine, and physical work. Earlier, I used to go for a lot of exercise, lot of walks, but then the frustration and all, it was not reducing. Stress was being reduced for the time being when you work out. But then the issues were there, were there in me about the people and all that. And I started working on these three only. I even now don't need even exercise. My relationships have improved and my body has become leaner. And people ask me, how has it happened? It's all due to the self-exploration and UHP. So I'm very confident about this. This is the vision. We all have to think about it. Right?
Very nice, Dr. Swapan. Maybe later in the rounds, we will talk to you also about your comfort level mentally with these proposals. For now, let's move on to Dr. Aprajita. What do you have to say regarding this about, psychosomatic disorders, that we may not be understanding the root cause? And if we don't understand the root cause, how can we address and cure the disease, like obesity, diabetes, essential hypertension, and all of those? So your thoughts on perhaps addressing the health at the root, that is in the self? Do you see a possibility of cure with this? It would certainly explain some of the medical mysteries like phantom limb and near-death experiences that we were talking about. Dr. Prachita, your views?
Nitya Prajita is not there.
Oh, so Dr. Dipesh,
Okay, right.
can we have your views on this?
Yeah. So basically, what I would say is that we have to really understand this concepts of the dependency or the impact of the self on the body part, and definitely the effect of the thoughts and the with respect to the feelings which we are having, and the impact of that on our body also has to be taken care. And I think we need to work on that. That's what I would like to say, Dr. Shamla, as of now. Okay.
Very nice. So you're saying perhaps more of working with these proposals.
Yes.
Yes, very nice. Dr. Mirunalini, how do you feel regarding the high financial burden on society? Healthcare in the current form is unsustainable. Do you think understanding the role and responsibility of the self in the health of the body could be one possible solution to this?
Yes, Dr. Sharmila. I've been listening to your presentation, and I think self has got a really important role to play regarding the sustainability. See, as of now, our current medical system, as you rightly pointed, the focus is more on disease. And so, when the focus is more on disease, then there's a huge evolution in the medical system. But in terms of developing the more diagnostic tests and putting in more economical financial resources to developing infrastructures and more tests, and then going on to procuring more medicines and treatment, the financial burden has, or I'll say the financial input has shifted more on procuring all these high-end equipment, state-of-art techniques, and all these advanced technologies, which again the focus is on only the treating the disease. But we were all blessed with a healthy body to be born with. The focus is not at all there how to sustain the health that we were all blessed with. So I think in this current form, even though the diseases are getting managed adequately and even very beautifully, even cancers are getting almost cured now. But I would say if we shift our focus towards how to stay healthy rather than putting more finances into managing the diseases, then I think this financial burden would end, because when it comes to staying healthy, all it takes, according to the program you have suggested, is to give some insight into our intake and incorporating some healthy daily routines and breathing exercises and looking into our postures, which is almost cost effective. That's not going to take much. And the only thing needed, resource needed, is the insight into the self, some self exploration, and a little amount of time that we spend to our health. Whereas the financial thing is nothing much is needed. So I would say if the focus is shifting more on self, this cost of rising health issues and the financial burden on the society is going to be addressed in a larger way. Thank you.
Very nice, Dr. Mirunalini. And I think you have also been working with some of the proposals. So we'll come back to you for that. And for now, coming back to Dr. Swapan, should we be looking at the human being in isolation from the whole, or do we need to shift in our paradigm here also? That the human being is a part of a family, the society, nature, and all of this existence. So when we look at health in the human being, shouldn't we be having a perspective that includes all of these? So that once we see our relatedness with every other being in nature, then we will be compassionate. Because if I see, nobody has to tell us to be compassionate about people in our family. Nobody has to tell us to take care of the health of our family members. Because somewhere we feel responsible and we have a sense of feeling of relationship with them. So what happens when we make this shift and look at ourselves as healthcare professionals and then deal with patients? Why are we not able to see that? So do you think better understanding along these lines would be helpful to see our relationship with all? Dr. Swapan?
Certainly, I think this holistic view, this is what I think the keynote address and all we are talking yesterday also have been talking, and this today also, the tone is set that we can't look the things in isolation. Like if you're talking about the human being in isolation, and that is what I think today we are being trained to be different and to become special. And that I think is creating the problems. How can I means become, and this isolation is creating a lot of issues. If you see within the family also, I can see in my region around families, already you talked also in your address that families are disintegrating so fast. And even yesterday we discussed that, okay, the families are disintegrating, and how can we support each other? Means the family is also needed, that compassion is needed. Only disease and only if you are just managing the disease, you are just focusing on the medicine, then but the compassion is also needed. That family member is sitting near you, it makes the difference. And then obviously from the society also, today I'm feeling isolated, so I'm not taking care of anyone around me, and so is the nature. So I think this feelings of relationship, as we have been talking, then harmony, and then coexistence. And then I have to see where are these feelings, means that can they be in the body or they are in the brain, because a lot of people bring brain also. But then high time to see that there is another concept, as you told in your presentation, I. It is I who has to see all this, and I have to do the right understanding. And with all this right understanding, I will be I will see that I'm coexisting with everyone around, and that feeling of relationship, harmony, and coexistence will bring so much harmony in me. Then I will be taking the responsibility of body also, because ultimately you have told in your presentation, but obviously this proposal has to be explored by everyone who is in this presentation also, that we are a coexistence of self and body. Even they are not in isolation. But today, if I see body in the isolation, then you see there are so many issues coming up, that all these psychometric disease and all, we are not able to handle it, because if we just limit it to the body. So certainly, if we will take it in the holistic view, I think a lot of these health issues will be solved automatically. We are saying automatically, but it will be with the right understanding. And then I think we all can start improving. Already we are doing, but then the pace will become better overall to improve in all this health and body also.
Nice. Very nice, Dr. Swapanji. I think more on this will be shared perhaps tomorrow regarding this implementation of this vision. But for now, the very fact that we see it as something desirable, something that requires more research, more attention, I think that itself is a far-reaching perspective, which we have not been alluding to in health till recently. Dr. Merunalini, I wanted to ask you, I believe you had also mentioned something, you have been working with these proposals, and some of the problems that you faced, how you were able to resolve those issues. Could you throw some light on how these proposals have helped you?
Yes. So, see, I had some health issues. Like I had, when I was doing my post-graduation, I had a series of problem in my body, starting with severe pain in my neck, which did not respond to any painkillers, and severe back pain. And I had this plantar fasciitis. I was not able to stand. Being an anesthesiologist, my job is to keep standing in the operation theater for hours together. And I had developed this plantar fasciitis, and I was not able to stand at all in spite of all the conservative management, like changing our footwear and taking pain medicines and everything. And then I started putting on lots of weight. Like suddenly I gained so much of weight. And I found out I had developed some thyroid issues also. And then I had some irregularities in my menstruation, and I started noticing that there were some cysts in my ovaries. So I didn't know then why all these things are happening to my body. So I went on to get treated by different specialists, and for all the pains, I started taking pain medicines. And for this cyst in ovary, they started prescribing some medicine saying that will reduce the cyst. And for thyroid, I started taking the supplements. but nothing seemed to work. Even after a few months, like 2 or 3 months of all these medications, there was absolutely no change in it. So what I did was I went on to do some research on my own, why all these things are happening. Is there something happening in my lifestyle that is leading to all these things? And then came across this thing called inflammation and autoimmune diseases. Like basically, the root cause was stress, which I was undergoing in my workplace. And then I started observing that whenever I took holiday for 2 or 3 days continuously, all these pains started subsiding. And again, when I rejoined my work after 2 days, all these pains they started coming back. So then I had a strong belief maybe this is because of the stress which has been mentioned in some articles. So what I did was regarding this stress thing, Mm, like what like I was a student and so I couldn't do much, but still I started relaxing myself a bit. Then I was not exposed to these proposals like what actually stress is, and so the current view on stress, like stress busters and all those things, but it did seem to work a little bit, but in the long run it didn't do it. But regarding the cyst in my ovary, I would say all the modern medicine they prescribe only some drugs to treat it, but I started changing my intake. Like I started eliminating some foods that might cause inflammation. Like I started eliminating gluten and dairy products in my milk, and we started adding the fenugreek seeds. In modern medicine they prescribed metformin tablet which basically reduced the sugars. So I looked for an alternative in Ayurveda, and they prescribed sprouts of fenugreek or soaked fenugreek seeds, 3 tablespoons every day in the morning and empty stomach. So I took that rigorously for 3 months, and some exercises I incorporated in my daily routine, and that's it. And after 3 months, I underwent a diagnostic laparoscopy, and the doctor said that my ovaries are clean and clear with no cyst at all. And only after that, what I started as an experiment, why to take tablets instead, try these, I started having a strong belief in all these things. So, yes, this program for health, for staying health, that really works. And I can vouch for it with my own life and
Direct
experience.
experience. Very nice, Dr. Mirunalli. That is really true evidence-based, clinical evidence-based kind of result, which you have personally seen. And it is quite amazing when you do the tests before and after, and like you mentioned, 3 months is not at all a long duration, but to be able to find such solutions which are nature-friendly, body-friendly, I think that is a wonderful kind of a revelation. And certainly, I think, one should work on these as a research project, perhaps. Some of us can take that up. Very nice. So, Dr. Deepesh, do you think it is time to bring in a holistic perspective as a possible solution to address many of these concerns? We're talking of psychosomatic, we're talking of the financial burden, we're looking at seeing ourselves as a part of a larger whole, having values. Many of these issues have been raised. Do you think a holistic perspective could be one possible solution to address these concerns?
Yes. So that is definitely something which we need to really look into. And in the yesterday's discussion, we have identified a few points, which is like the needs or the points which are lacking right now in the system, and which is leading to the ill health of the human being. And then right now, when I was trying to look what you have presented as the holistic approach, then from multiple dimensions or multiple perspectives, when I'm trying to see that, I could see that clearly that this could be one of the way out to the so-called problems which we are seeing in the health domain. So as you mentioned, in terms of the identification of the program of health for the human being, right? So in that context also, if you look, so just like Dr. Sopan was mentioning about the just change in his intake has made dramatic change in his physio, and he has come out with, even his relationship was actually in place because of that. So minor changes in the lifestyles, in the way of saying things, which would be reflecting in the health part of the human being. And also I was listening to Dr. Mrinalini when she was saying that about when she was from her life experience sharing that when she was taking rest for 3 days, many of her illness was actually going, and she could connect it to the stress being the reason. And when she took out some instead of the chemicals, going for the fenugreek, using that and bring out in 3 months producing results. So that is also showing that the holistic part of pointing to health. And also, if you look at the problems in the health domain, as the compassion which is expected from the healthcare professionals. So that also is pointing to the same thing, which is like a holistic vision. If at all, if we are able to give this holistic perspective as a value in the education system itself, that means even the students who are even before joining the medical school itself, they will have some kind of value education, and they will carry it forward. And then it will become a what you call a practice for generations. So that's how I see that. So probably in one sentence, if I put, definitely holistic health perspective is actually the talk of the time. I think that's what I would say.
Very nice, Dr. Dipesh. And I think for those of us who may not have tried it, perhaps it is time to be, at least be looking at perhaps more research in the area, perhaps more studies in the area. It is quite impressive, like you mentioned, what Dr. Mrinalini mentioned, and even what Dr. Swapan mentioned. And so if we could have such simplistic solutions to major issues, I think nothing like it. So very nice. I think we don't have much more time for questions among us, but now perhaps we can open the floor to the delegates, to the attendees. And so if you have any question regarding any of the statements that were put, or regarding the recap of the keynote and other talks that we have had, perhaps you can raise your hand and we will pass the mic to you. While that is happening, I think while we are waiting for people to come up with some of the questions, I think it's very interesting that even Ms. Rita Seth and Vicky Rai, they have also had a lot of success in dealing with mental health patients who were people had given up on communicating with them. So very often we think of differently abled or mentally disabled people as something different, and so we stop communicating with them. But when we look at this concept of the self, when we look at the fact that the self and the body, they are two different parts, especially if there is a problem in the brain, then the self is still around and we can still communicate, perhaps in not the same way, not in the same words, but with our feelings and how we portray ourselves to them. I think they had a lot of success, as they mentioned also. So it is, I think, definitely very interesting and very thought-provoking, that at least we should try to experiment with some of these conditions and see where it leaves us. If I recall, Bhutan Institute of Wellbeing had a wonderful example of treating young students with drug addiction, alcohol addiction, just with this content of the self and the body and the values. And they found a remarkable difference. So there are many such examples, and I'm sure you heard, all of you heard the sharings in the morning part, where people are relating to many of these, the experiments that they have done on themselves and the wonderful health results also they are having within them. One is having less stress, perhaps that leading to physical health improvements, and in general, other things like taking responsibility for the body and all of those. So, tomorrow we'll talk more about the implementation part. I think, so if anybody has any question, whether it be from the panelists or the delegates, we can take that. Yes. So I think perhaps our queries are exhausted at this time. But I think if I may conclude from this, is that many of us have felt that this could be one possible approach that may work. Of course, there may be challenges. There may be more research needed. There may be more of clinical trials or what have you. But I think at least if that possibility is seen, if that door is open, then we can certainly work with that. And I think there are many institutions here who, many of the people representing major institutions, where these possibilities could perhaps be made real. And I think this step sets the stage for tomorrow's discussion on holistic health, where we will be talking about implementing this vision. So there are some universities, some institutions where this has been implemented, and they have been finding some very good results. So we could perhaps take the cue from them and see how perhaps we could also maybe implement some of these proposals in our own institutions or in our own area of work in our regions. So I think this was a good, wholesome discussion that we could have. Now, before we close, if anybody from the panel would or have any observations to share, we still have perhaps 4 minutes. So if you'd like to share any observations, we would certainly welcome that.
I think it's very meaningful discussion, that this vision part. And tomorrow, I think the implementation part is the real, I think I'm looking forward to that, because need, I think everyone is clear because so much has been done, but still much more has to be done. And then vision also very nicely put by everyone by giving the examples also. And then I think the implementation is the real point, which I'm looking forward for tomorrow from my side.
Yes, very nice, Dr. Swapan. I think many of us may be looking forward to this, and we'll be very happy to welcome you all back. And I would say the same for the delegates, that please do join us tomorrow for the session, health session regarding the implementation of holistic health. It may be very helpful for those of us who are in various fields of work, in various institutions, in the government sector, in what have you. In fact, for anybody who would like to sort of have better health for themselves and for those around them. So with that, I think we come to a close for our health discussion for today, the panel health, regarding the vision for holistic health. And we look forward to all of you joining us tomorrow as well. Thank you, everybody. Namaste.